Hi, welcome everyone. We're so happy to have you here. We are going to get started with our In Our Backyard campaign launch event. We are going to get started. I am going to start with a land acknowledgement. So I'm going to take a few moments to do a brief land acknowledgement and provide a tool that we can all utilize as we discover the history of Staten Island, our birthplaces, and other lands as we travel. If we could all just take a moment to text our state and zip code to 907-312-5085. Again, I'll repeat that. So if you could please take the time now to get on your phone and text your zip code with your state to 312-5085. So that's 907-312-5085. This will also pop up in the chat. So once you do this, it'll text you back information about which Indigenous people's land we occupy. So please feel free to share that in the chat function, the land that you occupy. And you can also put in your birthplace or a place that you call home if you prefer. So the land on which Staten Island stands on is part of the ancient homeland and traditional territory of the Lenape people. We pay respect to Lenape people's past, present, and future, and their continuing presence in the homeland that we occupy. Acknowledgements are a collaborative process to be formed through continuous relationships with Indigenous people. An acknowledgement begins as a spoken embodied action. SIPCW and TYSA is proud to integrate this practice into our work, both internally and externally, with partners and community members. So we invite you to acknowledge the Indigenous legacy and commit to changing systems of oppression and injustice, taking a step toward health and true equity for all people. And now I'm going to move forward and pass this along to Jasmine Rivera. She is the Director of Behavioral Health on our team at the Center for Community Wellness. Hi, Jasmine.
Thanks, Abby. Hello, everyone. I'm Jasmine Rivera. I'm the Project Director for TYSA, which is a cross-sector coalition that is really focusing on supporting the positive behavioral health of young folks on Staten Island. So by cross-sector, I mean lots of different types of people, right? So it's not just the treatment folks, it's not just the mental health folks, it's schools, it's the district attorney's office, it's parents, it's young people, it's lots of different types of folks all working to support the mental health and reduce substance use outcomes for young people in Staten Island. So this is a very exciting event for us. It's near and dear to our heart. Historically, TYSA has been really focusing on substance use issues and opioid issues specifically. And by doing that from a population level approach, we have sometimes missed these outcomes and what's happening in Black and Brown communities. So as folks all know, when we look at Staten Island, the data is skewed, right? We have the highest median income, things like that on Staten Island. But when you really dig into the data, which Stephen will do in a little bit, you can see that these outcomes are happening in Black and Brown communities as well, even though substance use and opioid use specifically has been seen as an issue happening in middle-class white families. And while that's important, it's also really important to understand what is going on in all types of communities so that we can do our due diligence in addressing the issues. And we know that as TYSA, we have been a little bit irresponsible in addressing this properly up until now. So that's why we are planning this campaign and we're working on this event to help to bring some of these issues to light and start to work on these things as a coalition and acknowledge that lots of other people in the Staten Island community have been working on this issue and that we need to really get with it and start doing our due diligence. So as a part of this, what TYSA is working on, we have been engaged with courageous conversations to really think about working on an anti-racist approach. So we're not just talking about these issues, we're actually doing the work, we're unpacking these issues, and we're starting to look at what it looks like. And we invite all of you to partner with us in all of this amazing work and to do this, right? And I will now pass it over to Marilee DePrenville, who's going to introduce our data presentation and our speakers.
Good evening. My name is Marilee, and I'm one of the coordinators at SIPCW, and I'll be moderating tonight's event. Just really quickly, throughout this event, you can use our chat function to comment or put questions in. We're going to be monitoring questions, and at the end, we'll have a few minutes for Q&A where we'll answer some of these questions. So our next presentation will be by Stephen Chan. Stephen Chen is our evaluation coordinator at SIPCW. Where he works with the SIPCW team to support programs' various data and evaluation needs. He is committed to making data less scary and more useful for everyone, including our community members. Stephen received his master's in public health at Columbia University's Mailman School of Public Health, where he studies social medical sciences, focusing on social determinants of health and health disparities. Welcome, Stephen.
Thank you, Marilee. Good evening, everyone. I'm so happy you could all join us today for the launch of TYSA's In Our Backyard campaign. And as Jasmine and Marilee have already expressed, it's a campaign that is meant to bring attention and awareness to the impact that opioids and other drugs have had upon Staten Island communities of color, which are so often overlooked when we discuss the larger challenges of the opioid epidemic. Even in our work at TYSA, we recognize that our strategies to address substance use among youth and young adults have not always paid attention to the nuances of how our programming and messaging are received by diverse audiences. So for much of this past year, Abby has worked with a team of youth consultants to bring young voices of color to the forefront of our work by giving them the tools and resources to develop a social messaging campaign that really highlights the disparities in outcomes when it comes to substance use across Staten Island. The campaign remains data-driven and evidence-based, and I'd like to share a preview of these images and some of the data behind it with our audiences tonight before we release it to social media next week. So if you go to the next slide, this first graphic focuses on YRBS data from Staten Island high school students collected by the DOHMH. And it really highlights the differences in reported lifetime usage of cocaine among students of different race and backgrounds. Among Staten Island high school students in 2019, Black and African American students were nearly 2 times more likely to report cocaine usage compared to white students, while Hispanic and Latino students were nearly 2.5 times more likely to report cocaine usage compared to white students. One thing to note from this data is that Hispanic and Latino students have actually consistently reported higher lifetime cocaine usage compared to students of other backgrounds. If we look at the next graphic, it continues to look at YRBS data, but this time it focuses on reported lifetime heroin use. In 2019, we saw that 13.1% of Hispanic and Latino students and 12.4% of Black African American students, which is more than 1 in every 10 students, reported heroin use at least once in their lifetime. And that's compared to just 1 in 20 white students that reported the same. The increase in prevalence of reported usage among these two key demographics of students increased so dramatically between 2017 and 2019 for Staten Island that it actually drove the doubling of the Staten Island average reported rate. So next, I want to turn our attention to YAS data, which is data collected by TYSA from young adults in our Staten Island community, young adults ages 18 to 25. In this very first graphic, which we are focused on opioids, compared to the average Staten Island young adult, we see that Black African American young adults are almost 2 times more likely to report misusing prescription pain relievers and nearly 3 times more likely to report using heroin in the past 30 days. On the next slide, we also see that Black African American young adults are more than 2 times as likely to report misuse of prescription tranquilizers like benzodiazepines. You may have also noticed in these YAS charts that there is another group with a high prevalence of reported usage for each of these substances that I didn't mention, and that is the group of respondents identifying as Native Pacific Islanders. Since we were only able to survey a small number of Staten Islanders who identify as Native Pacific Islanders, we have to reckon with the fact that these figures may not be completely reliable estimates. And the same actually goes for the figures describing those who identify as Native American as well. It's certainly one of the limitations of our data collection that we aren't able to get as good a representation as we want of the challenges that youth and young adults from these two communities experience with relation to substance use. However, at the same time, we recognize that it's an area for us to improve and grow in, and whereby we can work with young people and community leaders in these two respective communities and others to better understand and address the substance use challenges that are affecting them. If we go to the very last graphic, this is a graphic that touches on overdose deaths and really highlights the major role that fentanyl has had in overdose deaths on Staten Island. This first chart breaks down the 2018 overdose death rates by race and borough, and the seafoam colored bars represent Staten Island. We see that although white Staten Island residents do experience a higher rate of overdose deaths compared to Black and Latino residents, these rates among Black and Latino communities are by no means trivial. The impact of the opioid epidemic on communities of color cannot be overlooked. Looking at citywide trend data from 2016 to 2017 right below, we see that as rates of all drug overdose deaths declined among white residents from 2016 to 2017, rates of overdose deaths actually increased among Black and Latino residents. In the case of fentanyl-related overdose deaths, where we actually saw overdose death rates rise among all groups, we can see that Black and Latino residents, Black and Latino communities saw a bigger percentage increase during that time, roughly a 150% increase compared to white communities that saw a roughly 120% increase. It's just yet another reminder that this opioid epidemic has had such a profound impact on communities of color, and that stakeholders working to address substance use in their communities must consider how these challenges impact all of their community members. Thank you.
Thank you, Stephen, for providing us with that data piece. It's very important to make sure that everything we do is data-driven. To continue putting down the foundation, and we're going to get a historical perspective, we have Debbie Ann Page, presenter. Debbie Ann Page is a public historian specialized in local African American history and a professional genealogist. She is the founder of PAIGE ONE ASSIST, a client-centered legacy research company focused on prompt professional commitment to service. She is a newly appointed member to the New York City Council Task Force and a senior policy analyst with the Council of State Governments, working with state policymakers and key stakeholders on issues relevant to veterans, communities of color, and the U.S. territories of Puerto Rico and the U.S. Virgin Islands. Welcome, Debbie Ann.
Thank you. Thank you. Welcome, everyone. Okay, thanks. So, yeah, I am a professional genealogist and public historian focused on Staten Island's history. So I thought when I was going to do this, where would I start? Staten Island has a long history of people of color here since the 1640s. But for the purposes of this presentation, I thought that I would start with the early 20th century. And so Staten Island has had its issues with race, and those issues of race bear out across a lot of fields. So Mrs. Dickerson was from Tennessee, and she was visiting Staten Island on a trip, just trying to see what they could do in order to better race relations. And so when she got to Staten Island in 1908, one of the things that she looked to see was that she was here for a few days, and she said she named all the different immigrant communities that were here. And she said that the Negro on Staten Island has no show for work, quote unquote. His help is not wanted. This is 1908, and we find ourselves in that same position now. And she says prejudice here is worse than in the South. Next slide, please. And so the thought was, all right, let's take a look and see about where people live, because housing tends to be one of those things that drive how we focus, how we do things, how we connect with communities. Next slide, please. In Staten Island, we have 5 towns, especially in the early 20th century. And those towns, we found African Americans more specifically, but people of color living in all 5 of the towns. So that is Castleton, Northfield, Southfield, Middletown, Westfield, which runs the gamut from north to south. Next slide, please. And in that, one of the things that I wanted to take a look at or examine were countries of origin for the people of color who were here, so we could kind of better understand what communities of color looked like in Staten Island in the early 20th century. Next slide, please. And so we'd be surprised to see that in pulling out the census data from 1915, there were people from Barbados, Bermuda, Brazil, England, France, but those people were still people of color: French West Indies, Haiti, Jamaican, St. Martin's. And 10 years later, just 10 years later, the number of places where people of color found themselves migrating from were, across the gambit. So they tended to generalize with the term Africa, but when it came to the Caribbean, they really parsed out which country people came from. Next slide, please. Thank you. Next slide. Thank you. So in looking at that and thinking about what Mrs. Dickerson was saying in 1908, the thought was then to shift our thoughts to communities of color and how they may or may not have faced discrimination here on Staten Island. Next slide, please. Thank you. So looking at the 1930s now, so we've gone from the 1910, 1915, 1925, now we're kind of at the mid to late 1930s, and redlining is a problem. The federal government is now saying what communities are worthy of building wealth in terms of financing and receiving government funding. Additionally, the government has decided that if you're building housing, it cannot be mixed race housing. So that again tends to separate out and create this vacuum of discrimination. And if you look across the map of Staten Island, you can see those parts of Staten Island that have these red lines. The majority of Staten Island is still rural in the 1930s, so they're not even mapped. But those places that are populated, you'll see on the fringes, definitely those communities that people of color tended to live in. Next slide, please. So I wanted to kind of show what they were talking about. So I chose West Brighton as one of the places. So D6 on the map, that on the lower right-hand side, you'll see is that is the community of West Brighton. And the things that the government says were detrimental influences was, one, if you'll see in the top right-hand, it says racial changes. And when you go down a line, it says trends of desirability for the next 10 to 15 years. And if this is the mid to late 1930s, the next 10 to 15 years puts us in the 40s and early 50s. There is a downward trend in terms of what the government says is going to happen there. And so it says foreign-born families. In the community of West Brighton, there are 90% of the families are foreign-born. However, the predominating culture or place of origin is Italian. But when they look at influencing issues, D says Negro, and there's a 30%, African Americans make up 30% of the West Brighton community at this point. But then they use the term infiltration, meaning it's a negative stereotype of people coming in that's going to reduce what the community, the benefits of the community or how the community is seen. And the infiltration group, or the group that's infiltrating into this community that is keeping it in a downward spiral, are what they call quote unquote Negroes or African Americans. And then it says, and you have to remember right now that they're either in the late stages of the Depression. And so there are many families here on relief. So you've got people who are out of work, and there's racial animus that's building because as Black people are moving into these communities, they're seen as a threat to the viability of the community. Next slide, please. So I wanted to kind of take a look at watching a neighborhood change. Next slide, please. Thank you. So by 1941, right, we're at the mid to height, we're at that point of what we call the Great Migration, where the African-American community is fleeing out of the South. They're fleeing discrimination, they're fleeing lynchings, they're fleeing a lot of different, the poverty. And so they're trying to find their way, they're making their way to the North, thinking that it is the place of refuge for them. And there's an ad in the newspaper that says the Empire State is going to be that refuge, that great refuge for these migrants. And actually, I would call them migrant refugees, right? Because they're really fleeing for their lives. And so they look at New York City in total as not a place to be, not a place that is kind to these migrants, except for Staten Island. They have the possibility of coming here because there's a shipbuilding and there's not a lot of people here. So there's a place here in Staten Island and upstate, places like Lackawanna or Buffalo, that would be beneficial to this community. Next slide, please. So I wanted to then pivot towards taking a look at NYCHA housing, because NYCHA housing is created in the 1930s, but it doesn't come to Staten Island until 1950. But remember what I said earlier about the government and building housing, mixed race housing. It's against the government rules to build mixed race housing. And so if you look, the first government project that's completed on Staten Island is called the South Beach homes or houses in March of 1950, followed by the Berry homes and Toad Hill. It's not till later. One of the last ones to be built is Stapleton houses, which happens to be the largest of them. Next slide, please. So by 1962, this is one of the ads that is placed in the New York Daily News, because now you're at the height of the Great Migration. And you've got millions of African Americans who are moving into these communities, and they're saying, would you panic if a Negro moved next door? Kind of still creating that space for discrimination and hate. And so, next slide, please. So I wanted to take a deeper dive and look at the community of Park Hill. So Park Hill is created, the first ad that you see, the Park Hill is created as a suburban urban renewal apartment complex. It's private. They're saying if you look at the bottom, it says pleasant suburban atmosphere, fine schools, good shopping, fast commuting. But in '69, you've got 5 years into the bridge opening, and people of color are starting to come into Staten Island at larger rates, and white people are moving out.
Debbie Ann, I'm sorry to interrupt you.
Okay, thanks. I'm going to go through quickly. So if you look at the next slide, you'll see that it then pivots to become public housing. They embrace the Section 8, and they break that down. And then by 1978, they're telling you, come here, come to Park Hill. It's no longer Fairview. Now it's free, free, free. Government's going to help you. Next slide, please. And by the 1980s, it becomes the Park Hill Projects, which so it moves from a suburban community into becoming the projects. And it has a mix of immigrants who have moved into the area without knowing the history of each other, and there's conflict that happens there. Next slide, please. So if we could play that video, I want to take the last 2 minutes, and here's where I'm going to wrap up. I'd like to take the last 2 minutes to play that video just for a little bit of it so that you can see where they've gone from suburban to the projects and the impact of crack and drugs within the Park Hill community and how that community has changed. That's okay. You can stop the video since it's not playing the sound. We can maybe leave the video as a link for others to be able to access it at a later date. So thank you.
Thank you, Debbie Ann, for providing us with that historical context of some of the racial issues, and also just laying down some of the historical context of some of the drug use in the communities. Hopefully, we're able to put it into the Facebook, or not the Facebook, the chat, so that people can click and watch it. Our next presentation will be by Erica and Ligar. So Erica Onaga from CHASI is a Chief Program Officer at the Community Health Action of Staten Island, CHASI, a division of Sun River Healthcare. In this role, Ms. Onaga oversees their complete portfolio of outreach, education, prevention, and direct support services for populations most affected by health disparities. Ms. Onaga has a wealth of experience on issues faced by low-income individuals with HIV and AIDS, behavioral health disorders, housing instability, and food insecurity. Ligar has worked in human services as an administrator, advocate, case manager, and classroom instructor in the New York City area with individuals, adults, children, and families for over 20 years. Currently, Lee serves as the Vice President of community-based programs at the Community Health Action of Staten Island. Lee holds an MA degree in counseling from Manhattan College and is completing his full CASAC certification. Welcome.
Thank you.
Thank you. Thank you. We're so excited to be here. I just want to talk a few minutes about what Lee and I are going to do. We have together over 40 years combined experience working. No, this is not our presentation. Working with people of color and in social service settings. So we're happy to share that experience as soon as we get our slides up here.
Yes, very happy to be part of this very important launch for In Our Backyard. So thank you all for having us.
Okay, next slide.
All right, so we just wanted to start off with a little slides to level set about some facts, not necessarily stats, that really impact us today. So we know that we've had an opioid epidemic for many, many years, but it was officially named in 2017, where it was officially declared a national public health emergency, but we know that's been going on for a while. So the nation came to the rallying cry. They decided to provide interventions. And at this point, we know there was a focus on white suburbia and rural white communities who were really being impacted by the opioid epidemic. So the intervention, we did wide-scale national attention. Everyone heard about what was going on. And there was significant federal funding and state funding put into programs for prevention, treatment, and recovery. Now, before this, you would think there would have been already a roadmap, because we've gone through this before. 30 years ago, there was a national public health emergency. It was not named that, but it was. And it was when crack and cocaine and opioids were really ravishing and really decimating our Black communities. Now, once again, the nation came up with an intervention. They saw the need for an intervention. And that intervention was the war on drugs. And that intervention, we are seeing it play out today, how it is still impacting and devastating families and communities.
I want to say just a little bit, thanks, Lee, to expand on the previous slide somewhat, in bringing our experience on the ground in. Certainly, I spent years overseeing programs for the DHS provider in Staten Island. And quite honestly, we were not prepared in working predominantly with people of color in that programming. We really weren't. I will say that honestly, we were not prepared. We didn't see heroin. We did not see the opioid use to the degree that we see now, right? So we were hearing about it, certainly in Staten Island, which was dubbed Heroin Island. And, we often would check in with our clients, but the heroin epidemic in Staten Island really got its roots from the prescribed medication, right? And so when those regulations changed and access to prescribed opioids became more stringent, more difficult to get, no more pharmacy shopping, no more doctor shopping, say 2012, 2013, that's when heroin was introduced. So I have to say, as a provider, our clients were not those clients. Not that they didn't occasionally use pills or have access to prescriptions to support maybe their symptoms, along with the methadone, which was the medication assisted treatment at that time. We certainly were not ready to face. It wasn't until, unfortunately, people started dying, folks that had never had histories of opioid dependence. Their drug of choice was alcohol, perhaps, or even crack cocaine. They were overdosing off of heroin. So I just wanted to, again, level set and give you the experience on the field. Next slide.
Just a couple of stats about drug and opioid overdose deaths among Blacks and African Americans. We're going to look at a very small window from 2015 to 16, very small window. And the rate of increase of overall deaths for the Black community was 40%. And that's compared to the overall population of 21%. And just taking that is in that small frame of time is pretty staggering. And that's also compared to other racial groups from 2011 to 2016. This stat superseded all of those groups during that time period. Also, compared to other populations, we've seen that Blacks and African Americans have had a high increase in the death rate for opioid deaths, and especially involving fentanyl. Over the years, we've started to see a rise in overdose cases for the Black community in that capacity. Next slide. Also, we really wanted to throw in some of our stats about our youth. We've seen that high school Latinx youth have a higher prevalence of drug use and opioid misuse at 16.1%. And high school Latinx youth had the highest prevalence of opioid misuse at 15.1%. And once again, that is a rate that is higher than the total high school population for all races at 14%. Next slide, please. So we also wanted to really focus in and look at some of the things that are happening with the criminalization of marijuana through a community lens. So we just really wanted to put some things into perspective. We know that Black and brown people are close to 4 times more likely than whites to be arrested for marijuana possession. And I thought this was very interesting. In 2020 in Albany, for 1 year, for a period of 2019 to July of 2020, 97% of those arrested or ticketed for marijuana charges were Black. And during that same time period, only 4 white people were arrested or ticketed. And we know that evidence has proven that Black and white people use marijuana at roughly the same rate. Next slide, please. And I wanted to bring it home just to be a little bit more specific about Staten Island. So far, Staten Island made 35 marijuana arrests in June in 2019. And that was far outpacing the rest of New York City. And according to some NYPD stats, the 120 precinct, they arrest nearly 3 times as many people on Staten Island, Black people, than all of the other 3 precincts combined. So I think that is a really staggering number. Next slide. And also, just to break this down just a little bit more, for the first quarter of 2020, so far there have been 132 marijuana arrests or ticketing. Out of that 132, 74 people have been Black, 49 Hispanic, and most of those arrests are people in the age range of 25 to 34. So we see that that is very significant. And also, too, we do know that when a person is arrested for marijuana, and especially a young person, it has so many different ramifications. It could be a loss of being able to get financial aid to scholarship. Of course, loss of employment opportunities. Also, significant fines, which lead to financial distress. And also just the trauma of being in the system, possibly being incarcerated. And this is trauma that can last for many, many years. Next slide. And we want to talk a little bit about some of the efforts that we're doing specifically at CHASI to really help our communities that have been impacted and our clients that have been impacted by some of these disparities.
As I said initially, and very honestly, we were a little late to the game, certainly in terms of my experience during the height of this pandemic in New York. We were working with clients and building systems and learning right alongside our clients and teaching them, really working to help them stay safe. And many of those interventions, quite honestly, were less focused on treatment and more about monitoring and, preventing overdose. So, the interventions in some of the residential programs that I oversaw was, insisting that folks that we were concerned about, for instance, left their doors ajar. So those types of things that, certainly don't provide the best environment, that are not conducive to having honest conversations. I'm proud to say that, just through paying attention, through bringing Narcan into the agencies and really training everyone and regarding the importance of Narcan and identifying those communities of use and, folks that use opioids tend to use them together. So creating safety within those communities, I think we did. I think we certainly turned the corner. Again, very late for the populations that we worked with in Staten Island in our permanent housing programs, Department of Homeless Service programming. So we really struggled with, as you may imagine, right, working in housing and residential settings, with creating an environment where honest conversations could happen, right? And we could not intervene and keep folks safe and figure out what work with them from harm reduction approach if we weren't willing to hear that they were using, if we weren't willing to create an environment within the context of their housing where we could hear that they were using and manage that use and not jeopardize their housing. So it was quite a struggle, I will say. We're very happy for the enhances in programming across the borough, right? Opportunities for Suboxone. Certainly there are differences in treatment and access to treatment shaped by race, right? We know that Suboxone is often available through private physicians and offices. And while there are some medication assisted treatment components that are a part of licensed OASIS 822 clinics, the majority of Suboxone is prescribed, at least on Staten Island, in private medical settings. So that those settings, and the majority of people therefore who access Suboxone are often white, where in the methadone clinics are in communities of color. And so there is much disparity, and those medications are treated very differently, right? Suboxone, you're often given a prescription. There's naturally, because of the way it's prescribed, there's a level of respect and trust there. You're given a prescription. Initially, you return more often, and then you're managing your medication, checking in perhaps biweekly, maybe even monthly, to manage your Suboxone, where methadone clinics, even if you're doing very well, you're going to the methadone clinic at least weekly to get your medication and pickups for the week, right? So if you're not doing as well, because they're off, through drug urinalysis, you're going to the methadone clinic every day. And there's often much more activity outside of those clinics. So,
sorry to disrupt. You have about 2 minutes
thank
left.
you. Next slide.
Great. So we will go into briefly some services at CHASI. One of our services that we started in 2018 is a low threshold buprenorphine program. And low threshold means we really just let the client come in and tell us where they are in their process, and we will walk right beside them with that process where they are. Low threshold means we do not require any urine screenings. Sometimes we do take them, but that's not mandatory. No one has to come in every day to receive medications. No one has to come in for ongoing meetings. And we think it's important for people to have choice. And we have found that so far, this has been really effective for some of our clients. Just to really walk into this space to know that, hey, we're not going to judge you, we're not going to pressure you for it, and we've had really good success, and we've had really good community word of mouth, where most of our referrals are from our clients who are receiving services, who talk to their networks, and they come in and they get on treatment, and we have a very high rate of people who are still with us. We have a current census right now of about 95 clients. We did have to pivot during the time of COVID, and actually COVID really taught us some really valuable lessons. The most important thing that happened during COVID was that we were allowed to do inductions telephonically, and being able to do those inductions telephonically, it really gave people more access to care and really broke down some hesitation that people, may have had about walking into a facility. I've heard that, hey, man, I've stayed out of treatment because I just feel like when I walk in a place, sometimes the receptionist or the desk person is judging me. And we also found out, we underestimated how powerful during this time texting is, and keeping a connection with our clients and engagement through texting. I think for a while that there was this kind of conception floating around that, people don't want to use their phones. People are going to talk about their minutes. We have had the total opposite of that, did not experience that. We found through text messaging that a lot of our clients are telling us more things, and maybe it's just that distance, but this is definitely something, the telephonic services, that we plan to really continue after we come out of COVID. And I really implore other agencies to really think about that and the power of using the telephonic services, and do not underestimate texting. The thing I will say about our peer program is that
Sorry, you're over.
We're over. I just want to say, in the interest of time, we will put the link to CHASI's website in the chat, so you can go onto our website and see all the services that we offer in this realm. Thank you so much. We've enjoyed being here.
Erica, and thank you, Lee, so much for providing us with that information. Our next presentation, just to push the agenda forward, our next presentation will be by Tiffany Barbola. She is the program coordinator at the Richmond District Attorney's Office at the Alternative to Incarceration Unit. She believes that equity and justice is a human right and is dedicated to rebuilding and healing our communities. Welcome. Hi, Tiffany.
Thank you. Before I get into the slides, I just wanted to give a brief overview of the Alternatives to Incarceration Unit. We are a small unit in the District Attorney's Office. We have a clinical director, an ADA who oversees all of our diversion cases, myself, a program coordinator. We have a data analyst, and we actually have our own internal peer as well. You can go to the slide. Diversion is the future. I really, really, truly believe that, and I believe that the district attorney also believes that diversion is the future. Our unit oversees all of the diversion programs that are held and housed in the Richmond County District Attorney's Office. Our unit specifically believes that anyone with a specific need, for example, a substance use disorder, should be met with a system that is willing to work with them, understand them, and adequately support them. Our unit believes this wholeheartedly. We put this into practice in all of our work, and we continue this work day in, day out, 24/7. Small graphic on the bottom is some of the programs that I oversee and coordinate, along with the clinical director and the rest of the team. Hope One is really what birthed the ATI unit. The DA had a vision that people who have a substance use disorder deserved an intervention of some sort and deserved to be linked to services and resources, as opposed to be given a criminal record and or potentially be in jail. So Hope One is really the birth of ATI. And then, as you can see, it is morphed into so many other programs and opportunities for diversion for folks. You can go to the next slide. So just to give a quick run of what all of these programs actually do for people, other than create opportunity for diversion, Hope One, again, is where it all started. It is a pre-arraignment diversion program. And so for folks who don't understand legal jargon, I will break everything down so that it's understandable. So pre-arraignment means that these individuals are arrested, and because they are arrested with a drug charge, criminal possession of a controlled substance, and they're receiving a DAT, this makes them now eligible for the Hope One program. And so the model that we've designed for Hope One and also for Hope 1.5 is a 30-day model. So once someone is arrested, the arresting officer will contact our Hope phone. We have a Hope phone that is active 24/7. And someone, either myself or our clinical director, will answer the phone personally and vet who is eligible for the program. And based on the criteria that's provided to us and the information that we're able to double check in our systems, we'll deem if someone is eligible. Once they become eligible or we deem them eligible, we actually activate a peer from one of our recovery centers that are on Staten Island and that collaborate with us to make all of these programs work. The peer meets with the participant in the precinct once they're released and connects them to one of the recovery centers for services. And the participant is expected to engage in some type of service in those 30 days. And once they have completed the 30-day program, their cases are not prosecuted. They're declined to prosecute. Our office declines to prosecute them, and it is sealed and erased, basically, almost as though it never happened. Similarly to Hope One, Hope 1.5 includes additional charges. So you don't only have to have a controlled substance charge. You can have a petty larceny or something else, but also have a history. of substance use. And then you would also be deemed eligible. Hope 2 is a little bit different. The model is also a little bit different. This is a post-arraignment diversion program. It's post-arraignment and pre-plea, which is a really big deal, and I'll explain why. When someone is arrested, post-arraignment means that they will have to still go in front of the judge and be assigned a defense attorney, but they can be offered the Hope program, the Hope 2 program, directly at arraignment. And this model is a 90-day model. And instead of someone having to plead guilty to a charge and then be eligible for the program, they only have to express interest. So if someone is eligible for Hope 2 based on their charges, and they are interested in the program, that is enough for us. And then it kicks into the similar model of Hope 1, where we still connect them with a peer, we still connect them with a recovery center, and they're expected to engage in the program for a 90-day period of time. At the end of those 90 days, when they've successfully completed, their cases are dismissed and sealed. And those will also not be on their record. So far, we have 3 programs where they end in the cases being sealed, which is a real benefit to anyone who is going through the system, because this will not appear on their rap sheet. This will not appear in a criminal history for them, leaving them opportunity that may not have been there prior to our unit. Lastly, we have the ORP program. It's the overdose avoidance and recovery program. It's a similar model to Hope 2 in the sense that it's a post-arraignment diversion program. So folks who are arrested will have to be in front of the judge, can be offered or at that time, and meet with staff from the court and be screened to deem them eligible. It's a small screening. Once they're deemed eligible, again, they'll be connected to a recovery center. And what makes OR very special is because it's for participants who have an overdose history or are at risk of overdose, there is no timeline with these cases. And again, this individual is not pleading guilty to anything. They are simply expressing interest in the OR program and are able to access this benefit. If and when they are no longer, I should say, at risk of overdose, then their cases too will be dismissed and sealed. There really isn't a strict time frame on this. We want to allow these folks the time to navigate the system, do it in their way. We want to practice person-centered care, even in the judicial system. So we think it's important to not have a very tight timeline on these cases and to really be able to be flexible and to work with these folks. You can go to the next slide.
Tiffany, sorry, you're off. So if you can just wrap up.
Okay. Yeah, so here we are at the wrap up. I wanted to wrap up with this image briefly, just because the phrases that stick out are basically exactly what we're trying to go for. We are aware that communities of color need opportunity, especially in the justice system, in the wake of George Floyd and Breonna Taylor, and all the other lives lost prior to and after, and the fight that we're still fighting. What we want to practice and what we need to ensure is that there is justice, fairness, and opportunity. Thank you, guys.
Thank you so much, Tiffany, for this. Our next presentation will be from Raymond Jordan, excuse me. Raymond Jordan is a peer who has worked for Project Hospitality for almost 2 years. He works in the Staten Island community to help with the opioid crisis. And during the pandemic, that has taken many lives of those who are close to him. This work is very personal to Raymond, as someone who has lived with the disease of addiction and who has recently celebrated 3 years of sobriety and away from drugs. Hi, Raymond.
Hi, my name is Raymond. I'm a little nervous right now. I just like to thank God for my life today, and the ability to help people. I started out my mother died and I was separated from my siblings. And I had 5 brothers and 2 sisters, and I was put in foster home, and I was put on the block, and they would call me a faggot. Like, I didn't even know what a faggot was. You know, it gave me low self-esteem. So I ran away and put me in group homes. I went to children's village, around a bunch of other boys. But, you know, I was just going to fight my battles because I understand why they called me a faggot. They gave me low self-esteem from the start, because my foster father said, you ain't shit. You know, never be shit, you ain't nothing. And I believe for a long time. Thank God for my sister. She got it together.
Raymond, do you hear us? You're breaking up. We can't hear you. Can you try again?
Okay. I said, can you hear me now?
Yes.
Okay, I just want to thank my sister because she's the oldest living relative in my family. You know, I started using drugs at a very young age when I was in home. Around a bunch of boys I didn't know, you know, because I went to theater and I always went to theater and I always thought that my first experience with marijuana and alcohol. You know, it wasn't until I started going out to the bars in the club that I discovered cocaine. You know, and it wasn't until I actually was put out the group home, had nowhere else to go. 18, you had to go. So I was living on the streets and shelters and stuff like that. And I was sleeping on top of my sister's building. I almost got addicted because I had to go. And I was too ashamed to tell her that I was smoking crack at that point. And when my friend took my money, when she took the money and she went to the crack house and she came back out, she had no money for me. I said, "Where's my money?" And she says, "No, just here's your money's right here. Just take a pull." And I took a pull, and I've been chasing it ever since. You know, crack is a very jealous drug. It don't want me to have nothing but it. It don't care about taking showers or nothing. So, you know, I did geographics. I went to San Francisco to stay with my cousin Sharon, and she had 2 foster kids, and I got on welfare because I just wanted to help her out because I didn't know my way around the city. And I remember her putting me out, telling me, you know, I'm gonna get me in trouble because I got foster kids. So I left her house, and then, you know, I was walking the streets, and I didn't know how to do anything. So I sold my body. And I sold my body, and I remember this guy telling me he gave me $5 instead of $50. So I went down and gave him another, you know, BJ, and I took his wallet. And at that point, I thought I got over on him. And he said, "That's all right, you son of a bitch. I gave you something that's gonna kill you." I never knew he gave me HIV. I never knew that, and that's how I contracted it. You know, but you know, still in all, you know, I just going back and forth to jail because, you know, crack is powerful. You know, it made me go in and out of stores. You know, but at the end of the day, like I finally came to a conclusion that, you know, I use drugs and I lose. I always lose. You know, I lose my family. I did a geographic. I didn't get a chance to spend time with my family, and that breaks my heart because, you know, my sponsor tells me I was doing this because I'm not worthy. Like I get into these toxic relations because I'm not worthy, right? So, you know, today I work with clients, and, you know, I explain to them, you know, my experience, strength, and hope. You know, I'm the hope for a lot of people. You know, I'm the hope for a lot of people. You know, I work for Project Hospitality. You know, thank you, Laura Novosad, for never giving up on me, for paying for me to go to school to take this course at CSI to be a certified peer recovery advocate. And I'm on fire right now. You know, I really care about people, have compassion like you don't want to believe. You know, my sister's proud of me. You know, I love my sister. I love my sister Linda. I love my niece JC. You know, these are family members that support me. You know, regardless to whatever I do. I love my sister Renee. You know, I'm praying for her husband right now. You know, I'm not selfish anymore. I used to be a selfish bastard. I care nothing about nobody but myself, but I'm not like that today. I really care. You know, I thank God for my life today. I'm able to have a refrigerator full of food, you know. And so, you know, my job today, like, I help people. You know, I go to work during the whole COVID-19. I was outside every day. You know, we got clients all over Staten Island. One thing about the disease of addiction, it don't discriminate. It doesn't care what color you are, what race you are, how old you are. Like I help multiple people, you know. And especially, I try to help gay people a little bit more right now because, like, the crystal meth is taking over the gay community. It's really taking over the gay community. You know? But I remember 2 years ago, my best friend Maria, we was making meetings, and I introduced her to our sponsor. And, you know, we had a Christmas party at my outpatient, and she said to me, "Raymond, why don't you sing Billie Holiday for me?" Because I sung a Christmas song for the entire, you know, outpatient. But you want me to sing Billie Holiday's "Good Morning Heartache." That was my best friend in recovery. Like, I never thought that she OD that weekend. And I got the phone call that she brought 5 bags of heroin and she died with 4 in her pocket and a needle in her arm. You know, Maria's not coming back. She was my best friend. She came to my graduation. You understand what I'm saying? Her and my friend Lamont, they came to my graduation because they support my recovery. But it was hard to see Maria go like that. You know, so Laura she felt so compassionate for me because she knew so many people in Project Hospitality loved her. They went to 514 Bay Street and she allowed them to have a service for Maria. You know, I've never been anywhere in my life where people care so much about me. You know, and today I love myself. I make 12-step meetings. I have a sponsor. You know, I love my family. You know, I wouldn't trade my family for nothing in the world. I love every one of them. You know, I have a relationship with all my brothers. All my brothers, I have a relationship with all of them. You know, I'm just so happy today. These are tears of joy. Like, I've never been this happy. I'm working. I'm doing something for the community. I'm no longer a menace to society. I'm no longer stealing. I'm not walking the streets spreading AIDS, trying to sleep with people. You know, I'm no longer in jail. You know, I was the person that went to jail for stealing and shoplifting, you know, and all this crazy, insane stuff that I would do. But thank you, Gary. I was working in an inpatient program, you know, Bailey Steen Hospital, the prep center. You know, I care about my clients. You know, Gary was the first person to give me permission to take the clients to conventions and meetings and outside meetings, introducing the sponsors. You know, I have clients that I'm so proud of today because they believed in me. And thank you, Susan, in CSI, who she taught me to meet people where they're at. You know, I have a supervisor that supports me. You know, went over some hours, they wrote me up, and I was devastated. But I own my peace today. Like, I don't do that anymore. You know, I listen today. You know, I'm not perfect. I'm not perfect by no means, but I have friends. You know, Amber, Yolanda, I love you so much. I have friends today, quality friendships. Darren, Lindsay, Darren W. You know, I have quality friends that love and care about me, that don't judge me. So it's okay if you're gay. It doesn't matter. The hell will people say about you? They're gonna talk about you to the day you die. You know. But I thank God. I thank God that, you know, I'm here today. I have a compassion. You know, I care about the community. I do Narcan trainings. If you look at Staten Island Hope.org, I'm part of that program. Just go online. You can read my story right there. I work with the district attorney. I've met Maxwell. I was on TV talking about the opioid addiction in Staten Island. This ain't no game. You know, drugs is taking our community. You know, they say Black Lives Matter, but how come Black Lives Matter if you gay? You know, why my own people beating me up? Why is it like that? Why is there so much hatred in the Black community towards gay people? That's insane. You know, but I still march. I still care. I still support people no matter what. You know, so if you do it, I am. If you struggle, you know, it's okay. You know, no matter what. You know, I love my life today. You know, I'm so grateful that I'm here. I'm so grateful to be of service. You know, I'm still here today. HIV positive. I'm still here today. I hope I'm giving somebody some hope out there. Don't lose. You know. Get away from some people that use it. Find you some new friends. Find you some new playgrounds. Find you some playmates. You know, if you ever have a problem, just reach any one of us. I didn't want to share because I said to myself, I'm thrilled about all the education that people have. You know, but then I got out of my own way. You know, and I'm glad these people are sharing this information. Information is valuable. You know, so if you're new than I am, it's okay. You know, if you're struggling, it's okay. I don't judge none of my clients. I just welcome that. You know what I'm saying? Doesn't matter what you use. You know, I don't care what meetings you go to. NA, AA, CNA, SA, GA, anything is better than sitting in front of the GA. You know, but sometimes that's important. Sometimes it got my life together when I sat in front of the judge and they were talking about giving me 6 years. And I told the judge, I don't want to die of AIDS in jail. It was so crazy in California. So, you know, now I'm doing something for the community. I'm no longer a society. You know, I love me today. Yeah, I still struggle with relationships. You know, I let him go. That was the freedom. So if you're new to I am, you know, just welcome. You know, thank you for letting me share.
Thank you, Raymond, so much for sharing your story and for the work that you're doing in the community as a peer advocate. We appreciate it. Our next presentation will be by Eleni Vazilakos. Hi, Eleni. Eleni works as an engagement specialist on the CHASI COVID-19 test and trace core team. Eleni and her team have been doing daily outreach to make sure that the community has access to resources such as mask and testing information.
Okay, thank you so much. I'm happy to be here. I just wanted to say thank you again to Raymond for sharing his powerful story. Was definitely crying a little bit there, but I'll try to pull it together for this presentation. I'm just going to talk a little bit about the coronavirus. You know, true to CHASI's mission, our T2 team tries to address pre-existing health disparities in the community. So I'll get into what I mean in a couple of minutes. Next slide, please. Oh, next slide. Oh, thank you. Okay. So COVID-19 is still a very serious threat. It's been a couple of months. I know a lot of us are very fatigued. New York spiked ahead of the other states, so we got it under control pretty quickly. But right now, because of schools opening, the weather getting warmer, colder, people spending more time inside, we're starting to see rates go up again. So because of this, we have to stay on top of COVID-19 testing, so we know that these activities could remain open. If the infection rate rises, we have to close our schools again. Next slide, please. So the reason testing is so important is if you get tested, you know whether or not you have to quarantine from other people. It could mean, the difference of saving a life. You could be contagious to others within 2 to 3 days of exposure. So 2 to 3 days before exhibiting symptoms, you're already contagious. You're actually more contagious then because you're shedding more virus at that point. And it could take up to 4 to 5 days to test positive. An asymptomatic spread is also possible. So you can have the virus, not show any symptoms, not even know it, and still be spreading it. So the only way to know that you don't have it is to get regularly tested. Anytime you spend time in a crowd, make sure to get a test afterwards. Next slide, please. Okay, so Black and Latinx communities are more likely to develop severe infections. And this is because, as a country, we have to deal with systemic racism. And until then, every crisis that we have is only going to, exacerbate those pre-existing problems. So because of, the historical racism that some of our other awesome presenters have talked about during this event, communities of color are more likely to have in what we call environmental caused health conditions such as diabetes, hypertension, asthma, and obesity. And we know that these are all risk factors for a more fatal case of COVID or a more severe case of COVID. So for these reasons, COVID has, killed more people of communities of color than any other communities, and this is completely unacceptable. So because of that, it's part of CHASI's mission to go into these communities and, make sure people have masks, people have access to testing, people know where their testing sites are. If you need any of this information or any resources, we'll be sharing the Test and Trace Core hotline number after this presentation. You're free to reach out to us. We can connect you or your organization to masks, face coverings, testing locations, everything that we can do to keep our communities safe. Next slide. Here are some numbers. Oops. Oh, before that one, please. Oh, we do this. Just that third bullet I wanted to highlight. It's just so striking. While even adjusting for an amount of infection, in 1 in 1,125 Black Americans will die from COVID if they catch it, compared with 1 in 2,450 white Americans. That's half the rate. So that's unacceptable, and we're just going to continue to try to ameliorate this by putting pressure on our local officials to address these issues in our communities and in our environments, and just try to make healthcare equitable for everybody. Okay, last slide. Oh, one more thing. If you do have to quarantine, you will be supported. If it's hard for you to, socially distance, New York City offers a free hoteling service for people, who live in maybe intergenerational housing. If you qualify, you'll be provided with 3 free meals. If you need help getting connected to these services, you can give us a call and we'll connect you to those resource navigators. Next slide. And just a reminder to get tested today. There are so many free testing sites all throughout Staten Island. You can text COVID test to 85548 to find your closest one, or you can give us a call. All right, thank you.
Thank you, Lenny, so much. We're going to bring back We're going to bring back Abby to introduce the PSA video.
Hi, everyone. We're so happy you're still here joining us. So happy to have you. So we just wanted to shout out some of our folks that were a part of being in this video. We have some youth from Staten Island, some young people, and I also want to shout out our youth consultants that we work with. The purpose of this video was really to bring awareness and to the fact that this happens in our own backyard, right? Communities of color on Staten Island are greatly affected by opioids and other drug use. So enjoy the video, and for resources, please feel free to check us out. Go onto www.TYSA.nyc, and if you have further questions, please reach out to us. Enjoy.
What about us?
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 What about me?
Go for it, Jasmine.
Thanks, Abby. So I want to thank every single person for coming today. This was an amazing lineup, an amazing event. We're so happy to have had all of our participants across all of our social media platforms. I also want to thank our speakers. So those were amazing, amazing pieces. Lots of different topics covered, but also relevant to why this issue of substance use, specifically opioid use, matters so much in Black and Brown communities. So thank you, Debbie and Paige. Thank you, Erica Onaga, Lee Gar, Tiffany Barbola, Raymond Jordan, and Eleni as well. A big shout out to our TYSA youth consultants. So this video would not have been possible, this PSA, without them. And so much of the work that TYSA has been doing recently has been so much attributed to what our youth consultants have been participating in and doing. So thank you. And folks will stay tuned for our social media campaign, which I'll talk a little bit more about in a moment. But they were also very responsible for that happening too. So thank you, youth consultants. Also, thank you to all the youth and the TYSA members that participated in that video. Takes a lot of courage to get there, memorialized in a video that'll be around forever. So thank you for that. And thank you for showing your heart and pride in Staten Island. I also want to thank the TYSA Coalition. So like I said before, we're lots of different types of partners. It's not just us people who work here. It's also volunteers spending lots and lots of their time, and everyone who spoke tonight, thank you again as well for volunteering your time for this. But a special shout out to our crisis prevention and intervention work group, as well as our TYSA executive committee, in addition to all of the partners, but for really helping to plan and execute this event. I also want to thank JMT Media. So this is a fancy platform that we could not do by ourselves. We want to thank you so much for helping make this possible. And then I don't want to forget the team at SIPCW. So Abby and Mary Lee, thank you so much for moderating, introducing, putting all this together. Sarah Blass, Adrian Abadi, our executive director, Sean Gonzala, and Iris Kelly, and again, Stephen, who presented earlier on the data, but thank you as well. If folks have any questions or want to know more about TYSA, please, we want to partner with all of you in this endeavor. We want everyone in the community to have a voice, and we want all of you to participate. So please reach out to us. You can go through our website, TYSA.nyc, to message us, or you can go on any of our social media platforms, and it's at TYSA Network on all of our social media platforms, and you can follow us there. You can send us a message. We're very responsive. And like Stephen mentioned earlier, again, that in our backyard campaign is officially launching on all of our social media channels next week. So please follow us and stay tuned for that. And Abby, if there's nothing else, no, thank you all so much for coming, and we hope to hear from you soon.